myself Dr. Sunitha Rani. My topic is role of B-scan ultrasonography in advanced cataract. No financial interest to disclosure. Ethical clearance was obtained from Hospital Ethical Committee. Introduction. B-scan ultrasonography is a simple non-invasive tool used for diagnosing significant abnormalities in posterior segment of eyes with opaque media like advanced cataracts, corneal opacities, uveitis, total hyphema. Ultrasound principle. Sound waves are generated at the tip of the transducer which has a piezoelectric crystal of quartz or ceramic. These high frequency waves from the probe are transmitted to the area of interest and are received back as a radio frequency signals and reconstructed in the form of image and displayed as echograph. The sound waves is measured in hertz. B-scan setup used for this study was Marvel to B-scan with ultrasound biomicroscopy by APOS Association with a probe frequency of 12 MHz was used. Aim of the study to evaluate the posterior segment pathology using B-scan ultrasonogram in patients with advanced cataract posted for cataract surgery, which would be of help in planning for surgical intervention and to assess the post-operative visual prognosis. Objectives: to evaluate the posterior segment pathology in advanced cataracts preoperatively, to assess the visual prognosis after cataract surgery. Materials and methods. Samples is 130 patients. Study period June 2022 to Jan 2023. Study setting: Department of Ophthalmology. Study design: prospective diagnostic study. Inclusion criteria: age group from 30 to 80 years, both sexes, and advanced cataracts. In patients where fundus cannot be viewed by ophthalmoscopy, patients already not known to have any posterior segment pathology. Exclusion criteria: patients already diagnosed with posterior segment pathology in patients where fundus can be viewed by ophthalmoscopy. Unwilling patients. Evaluation: a detailed history, best corrected visual acuity, intraocular pressure, anterior segment evaluation with slit lamp. B-scan ultrasonography is done using contact method. Results: the data is collected and results are analyzed using statistical package social sciences. The study includes 130 patients age range between 30 to 80 years with gender distribution 71 males and 59 females. Laterality of right eye is 67 and left eye is 63. A total of 125 non-traumatic cases and 5 traumatic cases are observed. Out of 130 cases, 71 cases showed posterior segment pathology with a distribution of 8.39% showing osteoid hyalosis, 2.29% showing vitreous hemorrhage, 3.07% showing retinal detachment, 1.5% showing posterior staphyloma, 10% showing posterior vitreous detachment, 0.7% cases showing PHPV. Age distribution: more in 51 to 60 years of age range. More in males. Osteoid hyalosis and B-scan: multiply densely packed, homogeneously distributed echo-dense dots of medium to high reflectively, usually localized to the core of vitreous body. A clear retrovitreal or pre-retinal space is seen. In case of posterior staphyloma on B-scan, it appears as sudden blowing back of globe with thinning of retinocoroidal layer, usually seen at posterior pole, and axial length of globe is increased. In case of retinal detachment, it appears as a echogenic dense membrane, biconvex or biconcave with 100% attachment at the optic nerve head. Persistent hyperplastic primary vitreous. It is developmental disorder of the eye which occurs due to abnormal persistence of fetal intravascular ocular vasculature, and B-scan echogenic band extending from the posterior surface of lens to optic nerve head is observed. Discussion: over the last 30 years, ultrasonography has greatly advanced, which has enabled us to study posterior segment of the eye even in the presence of opaque media like dense cataracts. It can use it for detection of lesions in anterior segment and orbit also. Conclusion: we conclude that B-scan ultrasound could be one of the diagnostic tools for detection of the hidden posterior segment lesions and could be performed routinely in preoperative assessment of patients having dense cataracts, which would be helpful in planning for the surgical intervention and to assess the visual prognosis. These are the references. Thank you.
Other than dense cataract, where you will do B-scan for cataract? What are the other indications for B-scan other than dense cataract?
In corneal opacity.
No, cataract. Which cataract you will do B-scan other than dense cataract?
Posterior polar cataract.
For what? Why you will do?
In posterior polar cataract, visual axis.
In visual cataract also we will do the same results. For what? To look for PC densities. Okay.
So
you have done contact method, huh?
Yes.
Not non-contact
Contact
immersion. You
method.
did not do immersion method.
Contact.
So what is the difference between immersion and contact method?
Which is better?
Immersion.
Okay, immersion is nowadays now most of the cases we have stopped contact because the exhale length, when you try to compress the cornea, the
Correct.
exhale length will be reduced. So your accuracy of calculation of IOL power will be changed. So nowadays it's only the immersion method where you are not going to come in contact. There will be an interface, that is tear film interface, which will help us in calculating accurately the exhale length. It is almost equal to that of the optical biometers. Okay.